All right, we'll go ahead and get started. Some technical difficulties today, so I'm going to be going off of two different computers here. I'm Dr. Stephanie Stahl. I'm a sleep medicine physician and neurologist here in town at Indiana University Health. I'm the director of the Sleep Medicine Fellowship Program, so I'm in charge of training future sleep medicine specialists and also an associate professor of clinical medicine and clinical neurology. And today I'm going to be talking about the foundations of sleep. And it's really important that you understand the foundations of sleep so that you understand why certain daytime and nighttime behaviors can positively or negatively affect your sleep. Let's see if I can get rid of that. All right, so I first want you just to take a moment to think about your own sleep. How many of you feel like you got a good night of sleep last night? Anybody willing to? Okay, good. For those of you that raised your hand, anyone willing to say why they feel like they got a good night of sleep? I was tired. Okay, so presumptively you went to bed easily last night, yeah. So when I feel like I got a good night of sleep, it's because I got sufficient sleep. About 7.5 hours is what I feel like I need. Didn't feel like it'd take me too long to fall asleep. Didn't wake up a lot. For those of you that didn't raise your hand, anyone willing to say why they feel like they didn't get a good night of sleep last night?
Because I was really tired.
Because you were really tired, yeah. So this morning probably you were really tired. So when I feel like I didn't get a good night of sleep, and yes, even the sleep doctor who does everything right most nights, I still have a bad night here and there, so know that that's okay. It's because I woke up too early or didn't get enough sleep, or maybe it took me a little bit longer than what I wanted. Now, before we dive into the foundations of sleep, I just want to briefly talk about why sleep isn't why we need it. And the bottom line is that sleep is important and essential. I bet you never thought the sleep doctor would say that, right? But why would I say that? So, sleep is a biological requirement. We have to have sleep to survive. It restores the brain and body. It helps us conserve energy. It consolidates memory, so it's essential for memory formation and consolidation, as well as just normal thought processes as well. Sleep is also where our brain clears out toxins or cellular byproducts that build up over the course of the day. And then also, importantly, it helps us regulate our immunity. And so, in fact, sleep is so important that we now know that it's essential for health and well-being. And many people, when they think about the 4 pillars of health and wellness, a lot of people readily think about diet and exercise. But we now know that mental health and stress reduction is key, as well as sleep. And in fact, a lot of people would argue that sleep is even the foundation of our health and wellness. So on to the 3 foundations of sleep, and that's our circadian rhythm, or internal body clock, sleep architecture, or the quality of our sleep, and sleep duration. And everything we do to enhance sleep comes back to one or more of these 3 foundations. I'm going to talk about each of these more, starting with our circadian rhythm. The circadian rhythm is our internal body clock that runs a little bit longer than 24 hours for most of us. In fact, some people can go upwards of 26 hours. Some people just a little bit less than 24 hours. But our body uses cues, especially light and darkness, to keep us on this 24-hour clock. In fact, if we didn't have these cues, or we just ignored these cues, this is what would happen to our schedule. And so this is something called actigraphy, which is kind of like a high-powered Fitbit that monitors activity and gives us a close marker of somebody's sleep duration and pattern. On this particular one, the shaded areas are sleep. But if we didn't have these cues, or we were inside all the time, what had happened is we would gradually go to bed a little bit later and keep waking up a little bit later because our internal body clock runs a little bit longer than 24 hours. Now, also with our circadian rhythm, assuming that our schedule is regular and our circadian rhythm is optimized, there's a very defined pattern of our energy levels and alertness over the course of the day. So for most people, we have a peak of our alertness around 10 a.m. to noon. So this happens to be a good time to be giving a lecture because hopefully you guys are at your alertness. Then we have a dip in our energy level around 2 to 4 p.m. So that afternoon slump that a lot of you feel, that's actually normal. That's a part of your internal body clock. One of the panelists has just said that she took an afternoon nap for 20 minutes. That's fine because that's a part of your dip in your energy levels. Then we have another peak in the early evening, and then our energy levels fall off in the evening. Now, a lot of people realize that our sleep and wake pattern is a part of this internal body clock, but a lot of people don't realize that a lot of the other functions in our body, our organs, other cells, and a lot of other hormones are secreted along with this internal body clock as well. And so you can see here some of these things like thyroid, growth hormone, melatonin, inflammatory markers, cholesterol levels. They all are circulated around that internal body clock. And so when our sleep-wake pattern is disrupted, all of these things don't function normally. These are other screenshots of actigraphy. In this particular one, the non-shaded areas are this person's sleep. And so when we think about our sleep habits, we want to be doing things that produce a pattern like this, a fairly set bedtime and wake up time, and not this pattern that you see here, right? So not only is this person's sleep and wake pattern all over the place, but all those things in their body don't optimize as well either. So what do you need to do to enhance your circadian rhythm? I already see some grimaces here. So we want to avoid bright lights and electronic devices in the evening. So I know many of you are thinking, now, certainly this thing cannot be causing disruptions into my sleep, but it does. And so why is that? So about 2 to 3 hours before bedtime, our brain starts to increase production of melatonin. Oh, God. And if we look at these devices before bedtime, it actually suppresses our melatonin production. But not just right then and there. Throughout the remainder of the night, the melatonin production will be less as well. And melatonin is certainly key to our sleep-wake pattern, but it's also an antioxidant and also plays a role in downstream effects of other hormones as well. And so when we look at these devices, smartphones, tablets, and computers, devices close to our face, not only is our sleep disrupted, but we have increased inflammation and there's downstream effects of other hormones as well. These are not things that we want, especially for autoimmune conditions. So 2 to 3 hours before bedtime and throughout the night, you need to avoid bright lights and electronic devices. Now, this is completely aside, but just because I get asked this multiple times a week as a sleep physician is, can't I just take melatonin and reverse that effect of my phone? The answer is no, because taking a tablet of melatonin is not the same as what your brain produces over the course of the night. So we need to be doing things that optimize our brain's own production of melatonin. Now, along the same lines, we want to make sure that our bedroom is dark as possible throughout the night, because any bit of light coming through our bedroom at nighttime is also going to affect melatonin production. And there's a lot of research on this. So, for example, there was a research study that looked at just 100 lux of light throughout a night. And that's just enough light to be able to see things in the room, but not enough to even be able to read anything on. But that just small amount of light was enough to cause sleep disruption, altered glucose or blood sugar metabolism, and also altered cardiovascular regulation. Also, surprisingly, the people in the study did not realize that their sleep was disrupted, even though there was a lot of objective evidence to suggest that it was. Another study showed that even light coming under a bedroom door was enough to cause tumor cell proliferation. There was another study that looked at any bit of self-reported artificial light exposure throughout the night, whether it was from a night light, TV being on, just light coming through the door, caused obesity or increased risk of obesity in women. And the highest risk was in women that left the TV on throughout the night. So again, you want the bedroom to be as dark as possible throughout the night. I personally, I've tried to get blackout curtains and everything I can to make it as dark as possible, but I still see light coming through, and so I personally wear an eye mask. It's not for everybody, but a cheap, $3 eye mask works for a lot of people to keep it dark. Now, as I mentioned already, you want to try to wake up the same time every day, regardless if it's a good night or bad night, work day or non-work day, school day or non-school day. It's all about setting that internal body clock, and again, trying to come close to this picture seen here. Now, while light in the evening is bad, light in the morning is really good for our sleep and our internal body clock. And it's not really fair because at nighttime, our brain is really sensitive to any bit of light. But in the morning when we need it, their brains are not very sensitive to light. And so we really have to make effort to get sunlight exposure, especially when we're working or we have school, because it's best to be outside if we can. And if we can get outside on a bright sunny day, maybe about 10 minutes is all you need to get the benefits. But if you can't get outside, you have to be pretty close to a window and looking out it to get those benefits and for a longer duration of time. So at least 10 to 30 minutes in the morning if you can, get outside or get some bright sunlight exposure. And when we have this light exposure, it's telling your body clock, hey, it's time to be awake and alert. It's boosting your energy levels, but it also boosts melatonin production and improves sleep quality at nighttime as well. Lastly, we want to have a set routine. So not only do we want to wake up about the same time, go to bed about the same time, but we also want to eat about the same time every day, exercise about the same time every day. Those are all things that are sending cues to your body to help regulate your internal body clock. All right, so moving on to sleep architecture and quality. This picture shows the normal progression of sleep stages in an adult in a typical night. And there's a very defined pattern of how we cycle through different stages of sleep. There's two main stages of sleep, non-REM or non-rapid eye movement sleep, or REM sleep. Stages N1, N2, and N3 are what's called non-REM sleep. And N1, shown here, is our lightest stage of sleep. And we're typically just in N1 sleep as we're transitioning from wakefulness to sleep. And we spend about 5% or less of our night in this stage of sleep, assuming that we have good sleep quality. But for someone that has a lot of sleep disturbance, such as that from sleep apnea, they may spend a lot of time just in this light stage of sleep and not get very much time into the deeper stages of sleep. Stage N2 is what we spend the majority of the night in. We spend about 50 to 60% of the night in this stage of sleep. If you ever heard of K-complexes or sleep spindles, this is where we see a lot of those in this particular stage, and it has restorative properties. Stage N3, our slow wave sleep, is our deep sleep. And it's most predominant in the first third of the night. And we spend about 15 to 20% of the night in this stage of sleep. This stage of sleep is really important for our health, especially our brain health. It's where it's thought to clear out a lot of those toxins that I had mentioned earlier. In fact, slow wave sleep is so important that a lot of researchers are trying to figure out how we can get more of it because of the benefits that it has on our health and our brain health. I heard a question this morning about marijuana, and so chronic marijuana use can completely abolish slow wave sleep. So as a sleep doctor, I strongly encourage people to avoid marijuana. We also need to minimize sleep disturbances for slow wave sleep, because if we don't get enough into those other stages of sleep, particularly N2, we're never going to get into the N3, the deep sleep. And then lastly, stage R, our REM sleep, is our vivid dream state of sleep. It's a common misperception that we only dream in REM sleep. We can actually dream in non-REM sleep as well, but those vivid, bizarre dreams, that is REM sleep. And we spend about 20% of our night in REM sleep. We normally cycle through REM sleep 3 to 5 times over the course of the night, and on an average night, each cycle tends to become a little bit longer. And of course, this has restorative properties as well. So when we are doing things to enhance our sleep, we want to do things that are keeping us on regular sleep cycling, and not like this top picture, and not this one on the bottom where there's a lot of sleep disturbances and not getting into and staying into those deeper, more restful stages of sleep. And these things to improve sleep quality. Oops. Unfortunately, it's not popping up here. But things to improve sleep quality include treating sleep apnea if you have it, avoiding caffeine within 10 hours of bedtime. It takes 10 to 16 hours for just one serving of caffeine to clear out of your system. And that causes more awakenings and also less deep sleep if it's still in your system. We want to avoid alcohol. That's another question that I heard this morning and talked about. Even light afternoon alcohol intake can cause more awakenings throughout the night and less total sleep time. Avoid nicotine, exercise, eat healthy, so a diet that is lower in carbohydrates is better. Higher carbohydrates cause more awakenings throughout the night. And then again, just another plug for we want to avoid those electronic devices within a couple of hours of bedtime because that adds to sleep disturbances as well. And then last, on to the very important sleep duration. Does anyone know how much sleep adults need to be getting at minimum? Yeah, exactly. So at least 7 hours of sleep. So this here is the National Sleep Foundation's recommendations for sleep duration. And you can see that adults 18 and older need to be getting at least 7 hours of sleep on a regular basis. And one of the most important things that you can do for your health is to ensure that you are getting sufficient sleep. Now, none of us sleep 100% of the time that we're in bed, by the time it takes us to fall asleep, and we all have awakenings throughout the night, whether we realize it or not. So assuming that you don't have insomnia, where our recommendations will be a little bit different. But for most of us, in order just to get 7 hours of sleep, we probably need to be spending at least 7.5 to 8 hours of time in bed just to get that seven hours. So if you have to wake up at 6, which is a pretty common time, that means you need to be in bed by 10:30 at the latest, probably to get 7 hours of sleep. Now, for those of you getting around 6 hours of sleep or less, I hear all the time, that's not so bad. That's close to 7, right? Well, the problem is that accumulates very quickly. So let's say that you are getting 6 hours of sleep per night. So by the end of that night, you're 1 hour short. So by the end of the week, now you're 7 hours short, or 1 full day short on how much sleep that you need. Now, over the course of the year, now you're 52 days short on how much sleep that you need. And this accumulation of lack of sleep is something that we call sleep debt. If you have a night here and there where you didn't get sufficient sleep, you can probably make it up within that week or so. But if you're chronically depriving yourself of sleep, it's hard to make that up. It's hard to make up 52 days of sleep that you've missed out on over time. Unfortunately, insufficient sleep is really common. About 30% of adults 18 and older don't get enough sleep. So we need to make sure that every night we're giving ourselves that opportunity to get sufficient sleep. Sleep deprivation has been found to be associated with a whole bunch of health issues, and I'll discuss more on the next slide. But I first wanted to highlight that insufficient sleep plays a direct role in inflammation. Sleep deprivation leads to an increase of systemic and tissue inflammatory markers, including cytokines and other mediators, leading to an increased risk of cancer, infection, neurodegeneration, which is Alzheimer's disease, and also cardiovascular disease, as well as possibly autoimmune diseases. I'm not trying to suggest that not getting enough sleep is why you have autoimmune hepatitis, because there's no evidence to support that, at least not that I'm aware of. But not getting enough sleep ramps things up in a way that we don't want to in autoimmune conditions. And so we really want to make sure that we're getting sufficient sleep. Now, this is an incredibly busy slide that also shows some other things that insufficient sleep can cause. And even though this is a super busy slide, it only shows a small fraction of what insufficient sleep can cause. But it can cause depression, can lead to increased risk of work-related accidents, increased risk of motor vehicle accidents. So when sleepiness is involved, it's much more likely to be a fatal or serious accident. High blood pressure, type 2 diabetes, cardiovascular disease like stroke and heart attacks, obesity. So insufficient sleep negatively affects our metabolism. When we don't get enough sleep too, it affects our hormones. And so we actually crave more high-fat, high-carbohydrate foods. So we don't make good, healthy food choices when we're sleep deprived. This statistic here, so there was one study showed that for every extra hour of sleep someone gets on a regular basis, it's associated with a 50% reduction in obesity. Other things, increased risk of medical errors. You don't want me and your other physicians not getting enough sleep. Leads to risk-taking behavior. Also leads to impairment in vigilance, thinking, decision-making, psychomotor function, your reaction time, your mood, your cognitive function. Again, I mentioned I'm a neurologist, so anything brain-related I always pay attention to. There was a really large study that was published a couple of years ago that people getting less than 7 hours of sleep, a 30% higher risk of dementia. Also impairment in logical reasoning, moral judgment, social functioning, interpersonal relationships. I heard this quote that when we don't get enough sleep, we all become tall 2-year-olds. But isn't that the truth, right? When we're sleep deprived, we're irritable, and then we also don't understand other people's emotions as well either. Also leads to an impairment in learning and academic performance as well as productivity. And so compared to people that get 7 hours of sleep or more throughout the night, those that get 5 to 6 hours of sleep have a 19% reduction in their daytime productivity. Those that get less than 5 hours of sleep, there's a 29% reduction in their productivity. And these things, as you can imagine, ultimately affect our physical health, our mental health and functioning, our health-related quality of life, and total mortality risk. So bottom line, again, make sleep a priority. It's essential for your health and well-being. I wouldn't have been asked to come here today if they didn't think it was helpful for you. And if you make sleep a priority and get good quality of sleep, you can have enhanced alertness, improved immune system, better mood, improved memory and learning, better relationships, improved productivity, and importantly, better health, and many, many more. And so again, I want you to come back and think about your sleep and think about what you can do to enhance your circadian rhythm, right? Keep a regular schedule, get bright light in the morning, avoid bright lights and electronic devices in the evening. What you can do to enhance your sleep quality, and also what you can do to ensure that you're trying to give yourself that time to get at least 7 hours of sleep on a regular basis. And then lastly, if you haven't already, be sure to check out the Autoimmune Hepatitis Association Sleep School. If you have your phone out, you can put it in here through the QR code, but lots of great lectures about sleep here on their website. Here, I'll go back. All right, so thank you. And I'll take some time. Yeah, question.
I work shift work. What do you suggest for that?
Yeah, that's tough. So the same thing is you want to try to keep the same schedule all 7 days of the week, which is really hard for especially night shift workers. But again, it comes back to that regulation of everything else in our body. So if we are having, we're sleeping at night or sleeping during the day on our work days, and then we're switching or flipping our schedule, that means that all those things don't function the way that they're supposed to, because some things are supposed to be secreted at night and some things are supposed to be secreted during the daytime. This is a time where we also say, try to get, when you come home from night shift, try to go to bed right away, get as much sleep that you can. But if you didn't get that 7 hours, take a nap before you go into work, again, trying to achieve that 7 hours of sleep. Yeah?
If you do everything right, because I've suffered with sleep for that, plus being on prednisone and now on letrozole in addition, sleep is a challenge. What is safe to take for people with autoimmune hepatitis to assist with it? I get up 7 a.m., 6:30, 7 a.m. every day. It's the nighttime that's very hard to get to sleep.
Yeah, and you mentioned the prednisone, and that is very difficult to get sufficient, even if you are taking it first thing in the morning. So the first thing is to evaluate for risk factors for sleep apnea, especially on prednisone. We tend to gain a lot of weight in this area, which increases risk of obstructions in our airway.
CPAP.
Okay, good.
And I use it. Love
Good.
It's never been an issue. My whole family, skinny people, fat people.
Yeah.
We all have it. It's the palate. It's the
And that's a really good point too. So a lot of people think that they can't have sleep apnea if they have a normal body mass index, but 30% of people with sleep apnea have a normal body mass index. Sometimes our PAP machine reported AHI, pauses in our breathing, is not accurate. So if somebody's still having a lot of sleep disturbance, tends to be worse in women, we will bring them back in for a sleep study with the PAP machine on to make sure it is fully optimized. As far as medications for sleep, for the most part, we try to avoid medications. They're not that effective, so about 1 in 5 people actually get some benefit, so most people don't actually get any benefit. They come with a whole bunch of side effects, including there's some research that it may increase mortality, like earlier mortality and cancer risk as well. The recommended first line of treatment for insomnia is something called cognitive behavioral therapy for insomnia, which is typically done by a sleep psychologist who's went through extra training in behavioral sleep medicine, where they work with you more intensely on good sleep habits, your sleep schedule, but importantly, the way that you think about and approach sleep, getting your mind to settle down. And it's been shown to be beneficial for no matter what the underlying cause of sleep is. Did it kind of answer your question? There's several sleep aids out there, so it depends on if we've done everything else and rolled everything out, then it becomes a conversation of, are you having troubles going to sleep? Is it trouble staying asleep? And trying to tailor the medication appropriately while also taking a look at your other medications as well, because there's a lot of interaction with them as well. Yeah.
I have just been diagnosed, but I also have sleep apnea, and I have low oxygen levels. So is there any relationship, because I'm having trouble adapting with the CPAP because I can't breathe. I have sinuses that are swollen. So the AIH, does that have anything to do with
That's a good question, and I have not seen that in research, but this is a rare condition where sometimes it takes years before people kind of uncover a correlation between the two. As far as low oxygen levels at night, it shouldn't have anything to do with this space here. We open up the air space to treat with the PAP machine. It should be treating the obstructive sleep apnea. When somebody has persistent low oxygen levels despite treating their sleep apnea, that means that there's a ventilation or a perfusion issue. So something with the lungs or the blood vessels or the heart that's leading to those low oxygen levels. Sometimes too, with low oxygen levels, when we haven't been taking deep breaths regularly, that our lung tissues shrink down. And so for some people, if we're just on a PAP machine for a few months, it can help open up those air spaces as well. So seeing a good sleep doctor is what you need to be seeing. Yeah.
Any comments on nose breathing versus mouth breathing?
Yeah, what a good, there's a lot of things coming out about that. So we ideally want to breathe through our nose throughout the day and throughout the night. If we sleep a lot with our mouth open, it can narrow the airway in some people, leading to a higher risk of obstructive sleep apnea. It also makes it a little bit more of a challenge to use a PAP machine throughout the night. Really important in kids too, to make sure that they're trying to promote nasal breathing as well, because as they're going through development and facial development, if kids are mouth breathers, they actually won't have full development of the space of their face. Yeah.
You said, sorry, do you also encourage breathing out through your nose, or does the breathing out not matter?
Yeah, that's a good question. I don't know the answer to that. I would say just in general, trying to breathe through the nose. I heard for people that are trying, like having more difficulties breathing through their nose, obviously trying to treat nasal symptoms as much as you can, but some people just pop their mouth open, like they just learn to breathe that way, even though if they can breathe fine through their nose throughout the day. But while you're exercising, it's really hard with really intense exercise, but more moderate exercise to really focus on trying to breathe through the nose tends to help people become more nasal breathers. Yeah.
Do you have any opinions or comments about like mouth taping at night?
Yeah, so first of all, if you're snoring, which is what most people are using the mouth taping for, I would encourage you to talk with your doctor, consider a sleep study, because when people have snoring, especially if it's loud or frequent snoring, most people are going to have sleep apnea, and mouth taping is typically not going to treat the mouth taping. The only time I talk about the mouth taping in my clinic is in people who we are trying to use a CPAP on. We want to direct the air just through the nose, and we don't want the mouth open and air flying right back out of it. There's full face mask too, and that's actually less preferred from a medical perspective. And so we talk about using a chin strap, and on rare occasion, mouth taping as well. It's becoming more of a conversation just to help us keep the mouth closed and optimize treatment of sleep apnea. Other questions? Yeah.
I went for a sleep study, and I don't think I slept the whole night. But they said my sleep study was normal. I can tell you, I watched, I watched television and I turned the television on. But I was just laying there looking at the ceiling, and by the time my sleep study was over, went home and I got the results, and they were like, "Oh, your sleep study was normal," and I was like, "It couldn't have been normal."
So sleep studies, the way an overnight sleep study works is when you're in the sleep lab is typically a sleep technologist that's with you that night reviews it. Then the next day, a daytime technologist reviews it, and then it gets sent to the physician for review. That being said, there's still a lot of subjectivity to it. And so out of the many thousands of sleep studies that I read every year, there is yet to be a sleep study that's come to me that I've 100% agreed with the two prior technologists that before it comes to me. Brain waves for most of us look very different when we're awake versus asleep. But if we are popping in and out of lighter stages of sleep, it can be more complicated. If we have dementia and other things too, it can become complicated as well to define that. So one, it's a possibility that it wasn't scored correctly or evaluated correctly. Sometimes too, when we're just in that very light stage of sleep, that N1 sleep, or just very briefly dipping into the N2, our perception of whether we've been asleep or not is not very good. So if we were to let you sleep for about 5 minutes and wake you up, you might think that you hadn't been sleeping at all. So there might have been some sleep on there. But it depends on if you got into REM sleep, because that's when sleep apnea tends to be at its worst. So certainly if you are still having symptoms suggestive of sleep apnea, I would do another test. Usually the in-lab studies are more accurate, but this is a case if you slept really poorly in the sleep lab, we might want to do a home sleep study in you where you can sleep better in your home environment. Yeah.
What do you think about the sleep apps, particularly like the Apple Watch app? Are they accurate? Are they just good information?
Yeah. Thanks for asking that, because we get questions about this all the time. So the Apple Watch and Fitbits, in people that have no sleep issues, it can give us a decent marker of sleep duration. There was just a study that was published that it tends to underestimate our actual sleep. But a problem with these devices is we all have awakenings throughout the night. In fact, we all wake up on average, so assuming no sleep issues at all, about 10 times an hour really briefly. And so when people get these reports from their Apple Watch or their Fitbit and it shows that they were restless for X amount of time, for the most part, it's just showing normal awakenings throughout the night and leads to sleep anxiety and worry. Another thing, too, is these devices are not accurate as far as detecting REM sleep and deep sleep as well. So like at least once a week, I have somebody that's saying, "Oh, my Apple Watch is showing I didn't get any deep sleep last night." The only way we can detect the deep sleep is if we have EEG right now. So things hooked up to our scalp to monitor brainwave activity. But yeah, thanks for asking that question. Yeah.
Is the Aura Ring included in that explanation?
So the Aura Ring is fairly new, but is falling into the same category from what I've seen so far. So also cannot give us a good marker of deep sleep because, again, we don't have those electrodes hooked to our scalp.
If you're not adapting to the CPAP, there's supposed to be something.
Oh, yeah. I used to be one of the only people in the whole state that used to do that. So first with the CPAP, it's the most effective treatment because it's the treatment that can take all of these tissues that are causing these obstructions in our airway and open them up. So when somebody's seeing me, the first thing I want to make sure is that they have tried every different styles of PAP mask, really try to see why they can't tolerate it. Is there something that we can do different from a pressure standpoint? There's a lot of interesting research coming out about the way that we used to use pressures to treat sleep apnea and what we thought was optimal for comfort. Turns out that may not actually be accurate, so kind of changing the way that we're going through that. As far as all the other treatments of obstructive sleep apnea, they're not near as effective because you're targeting a smaller anatomical space. So that device that you're referring to, I'm assuming, is Inspire hypoglossal nerve stimulation. And so it's an implanted device that stimulates one side of your tongue forward. So all throughout the night, your tongue is shooting out to the left. So it's trying to open up this airspace through here, but not near as effective as the PAP machine. We have about a 70% chance of getting those pauses to less than 15, normal's less than 5. So a fair number of people still have some mild degree of sleep apnea. 30% of people still have persistence of severe sleep apnea. A lot of specific criteria you have to meet for that as well. So always we try PAP therapy first, especially if you have moderate or severe sleep apnea. Yeah.
What's your annual CPAP? Is it for life?
Yeah, I get asked that with almost everybody that's been diagnosed with sleep apnea. For most people, yes, it tends to be a lifelong condition. The exception are if somebody has obesity and they've lost significant amount of weight, that may lead to resolution of sleep apnea. But it takes a 10% reduction in body weight to make just a 3-point reduction in those pauses in your breathing per hour based off of research. So somebody with mild sleep apnea, they may be able to make it go away with weight loss. But for people with more significant sleep apnea, while weight loss tends to improve it, it doesn't usually go away completely. So for most people, yes, lifelong condition. Yeah.
Can you talk about teeth grinding and how that can impact sleep?
Yeah, and so I feel like there's not a lot of great research about teeth grinding or bruxism. We know some things. So untreated sleep apnea can lead to teeth grinding. We know that certain medications, particularly antidepressants, can cause teeth grinding. But the biggest risk factor for teeth grinding is type A personality. You can't change who you are. So seeing a good dentist who can kind of do a good evaluation, make a good mouth guard, looking at your medications, treating sleep apnea if you have it, are all things that I would recommend. All right, any other questions? I think we're over time. Technical delays added to that. Yeah, go ahead.
You mentioned those other therapies because just speaking for myself, at night my brain never shuts down.
Okay, and that would be a perfect thing for that cognitive behavioral therapy for insomnia. So one of the things I tell people to do is you need to give yourself at least 1 to 2 hours of winding down before you get into bed. That means no work, no household chores in that time frame. You need that time to wind down and relax. For someone like yourself that mentioned his brain kind of always going or a lot on your mind, you want to get in the habit of before your wind down time frame, just get a notebook and jot down everything that's on your mind, to-do list. For problems, think there's solutions. For really big problems, though, are things that you don't know what the solution is. Don't think through all these things that you have to try to do to resolve that big issue, but think of something you can do the next day that works towards that issue. So the whole idea is that you're clearing your mind. Now, when you go to bed at nighttime, your brain is still going to let thoughts pop up into your mind, but your brain exercises to catch yourself, remind yourself, hey, I've already thought about this while I'm wide awake. There's nothing I can do about it, midnight, 3 a.m., whatever it may be. It takes practice. In fact, most of the things that we talked about, you won't see immediate improvements in your sleep. It usually takes about 3 or 4 weeks of doing something before sleep starts to improve. But I definitely encourage that. That's called worry scheduling or constructive worrying. And then also relaxation techniques and mindfulness is really helpful for that as well. There's a completely free phone app. Again, I don't want you to look at the phone right before bedtime, but a completely free phone app called CBTI Coach that has some straightforward good sleep practices on it. It also has some straightforward relaxation techniques. And those too take practice, but working on one, figuring out which one works best for you. Something called visual guided imagery where you picture yourself in a different place, like walking through a forest or on the beach. That tends to be very effective, but you do have to practice that scenario to get to it. And then mindfulness meditation, there's so much benefit coming out about health and sleep. They have somebody in the cancer building that works on that because of that role that it can play. So I would encourage that. That's what I do when life gets out of control. I do the constructive worry and work on the mindfulness meditation. There's a couple phone apps that I like for the mindfulness meditation. 10% Happier and Headspace. 10% Happier is my favorite of the two. They both have very expensive paid portions, but I think for most people, there's a free trial that's indefinite. As long as you don't go over, like you want to go further, that's fine for most people, and that's what I use as the free version. But yeah, the cognitive behavioral therapy for insomnia, that's one of the key things that they target is helping you get that mind to settle down at bedtime. Other questions? All right, thank you for being here.